I'm Ed Highland and welcome to DDW TV. We of course are here for DDW 2022 at the beautiful San Diego Convention Center in San Diego, California. And I'm joined now by Yalini Vigneswaran. Thank you so much for coming by and sharing with us today.
Yes, thank you for having me.
We're going to be talking about COVID. You're an SSAT session speaker, and really a lot of folks are dealing with COVID then, meaning just recently, and COVID now. So how has COVID changed your practice?
Yeah, it's a great question. I think, obviously all of us have had to deal with this coming out of the pandemic and what it has turned into, as you're saying. I think, the biggest change for me in terms of how COVID's changed my practice is telehealth medicine. If I had to pick one thing, it definitely would be that, telehealth has really taken a big presence within my practice. I still continue to do telehealth clinic at least once a week. I think what it does is it increases my availability for patients. Obviously there's patients that I see. I'm a bariatric surgeon and a foregut surgeon, and so I have patients that are immobile, and it's very difficult for them to come into the hospital or the clinic at times, so that makes it easier for them to do these visits from home. Patients that don't have the resources or can't take time off from work, this is a much shorter interaction for them that they can afford to do. And even just patients from out of state or from other destinations. We often see a lot of patients at University of Chicago that come from Indiana, Michigan, Wisconsin, other places, and so for them to be able to have these opportunities for virtual interactions is obviously a benefit for them, and increases who I can see as well. So I think that's been the biggest thing. I think also as a surgeon, it's pushed my boundaries in terms of keeping patients in the hospital during this pandemic. We were trying to be as efficient with our resources, beds in particular, and so I do a lot of my anti-reflux surgeries now as outpatients. Patients go home the same day, and that really has been driven by COVID. And I've seen a great benefit from that as well.
Well, at this point, what kind of tips can you give to clinicians about what they should be doing in their practice? And kind of as an aside to that, the changing attitudes, if you will. A great many patients and others are kind of looking at this as, well, gee, do I still have to do the basics, like wear a mask?
Yeah, very good question. So I think, going forward out of this, obviously we still have to be precautious. We're seeing more, these waves and increasing in people that are exposed, whether that's clinically relevant or not, I think is a different question. But I think as we keep coming out of this, what we're going to see is an overflow of patients, those patients that weren't seen over the last 2 years. And so really seeing large volumes in our clinics, in our procedure rooms, in the operating room. And so my advice going forward, the most important thing is going to be managing those volumes and how we're going to do that appropriately. I think it's twofold. I think one is really understanding how we're going to prioritize certain patients, because there are going to be a lot of patients that are behind on their surveillance and they need, routine care. But there's also going to be those patients that are more symptomatic and need more urgent care. And so I think one thing in particular is going to be figuring out how our schedulers and nurses can prioritize these patients in our templates, and making sure there's openings for more urgent patients, because things are going to get filled up quickly with a lot of this maintenance and surveillance. So that's one, and then two, again, efficiency with resources, and that's something we've been dealing with for the last 2 years. As a surgeon, what we've had to do is, kind of move away from the classic ways we think about operative time and block time, and being a little bit more efficient, either releasing that time so that we can maximize the usage of the ORs in this time where our elective practices are going to really rev up at this point. So I think it's going to be interesting the next year. I think we're all going to stay very, very busy.
I was going to ask you to look in the crystal ball. What do you see, coming forward over the next 6, 8, 10 months?
I think it's going to be busy for all clinicians around. I think, as we've been going through this, burnout has been, something that everyone in the healthcare field has been dealing with, and I think we're going to have to really keep our gas on wellness and all of this too, because I don't think it's going to be slowing down anytime soon.
Absolutely, we need to stay safe.
Yes.
Yalini, thank you so much for coming by and sharing with us. And this is DDW TV. I'm Ed Highland. Thank you once again for joining us. And of course, you'd like more updates, and I know you will, at news.ddw.org.